Alright, so back in the OR today, so we're doing a BBL with arm lipo and lipo 400. So we have our lovely patient here. She's a little bit on the thin side, but if anybody can find the fat, it's always definitely me. So the goal with lipo 400 is to remove all the fat from the bottom of the breast all the way down to the pubic area. So that's upper abdomen, lower abdomen, pubic area. And then I always do this area right here, which is kind of the bra roll and axilla. I notice a lot of people get lipo elsewhere and this area is never touched. And that's what makes my lipo 400 different. So I do all this and all of this area here. In addition, I do all of the upper back, the middle back, the lower back, and what we call the sacrum. Once I'm done, you won't see any visible scars. You won't see any scars on the tops of the butt here, on the side, or underneath. All of this is done through discreet, very well hidden incision. For the arms, I always make a tiny incision in the elbows, and that allows me to get all the way around the arm, the back, the sides, and the front. Everybody wants something a little bit different with their buttocks. Obviously, we're here today to add a little bit more volume, add a little bit more hips. I always let the patient decide what's best for them, but my goal is to make sure I deliver the best possible product for her body. What are you hoping to get today?
Tiny waist.
Tiny waist.
Juicy booty.
Juicy booty.
Tiny waist, juicy booty.
Say less, that's what I'm here for. I'm gonna start marking you up. So everybody looks a little different when they're standing up versus when they're laying down. So as surgeons, we make markings just to kind of help us define the anatomy and what we're looking at, especially as we're laying down. Okay, so we'll just go over my markings one more time here. So lipo 400, I'm gonna lipo this area down here, here, and here. We're gonna do some high definition, really bring her abs out. We're gonna lipo kind of this lateral chest bra roll area and really help sculpt and bring this waist in all the way to her rib cage. And then I'm going to lipo her lower back here, her middle back, and her upper back, along with contouring to her arms. There's just a tiny incision right there. And then we're going to augment her buttocks here and her hips. We don't want anything that looks crazy. We want something that looks really good. It really stands out, it pops, but it's not something that doesn't match her body. Lucky for her, she has really nice legs. And so her butt, no matter what I do, is going to match her thighs. And so some girls have really small legs and doctors will go put large, butts on them. I don't agree with that. But with her, she has excellent, very, very fit and large thighs overall, so her butt is gonna match perfectly today.